Alcohol sales resumed this week, with government saying declining coronavirus numbers are easing the burden on hospitals. Let's find out how the Democratic Nursing Organization of South Africa feels about this. We're joined via Skype by Cassim Lekhoathi, Denosa Acting General Secretary. Dr. Lekhoathi, thank you very much for joining us here on eNCA. Would you say that you are in support of the alcohol ban being lifted?
Thanks for hosting us. Obviously, from the point of Denosa, as a health organization, there's no way that we could have supported the lifting of the opening of alcohol, for the simple reason that we know the repercussions thereof, and we cannot talk from both sides of our mouths and saying, no, there is responsible drinking. I still need somebody to convince and advise me. Where is responsible drinking? Without delivering on this matter, this is almost a week now that we have lifted the sale on alcohol. Already we are getting reports on the ground that our people, our staff, are being affected. There is domestic violence, it's on the increase, and next week, majority of our employees are going to get paid. We're going to see a spike in terms of the behavior. Our CEC, community health centers, are also areas where we have to treat people with COVID. Now, especially the young people, when they are drunk, they come there to the institution and they want to accompany their fallen heroes, the injured hero. Now, we cannot allow people to still accompany people into the facilities because we are having a problem. We are dealing with COVID here. Now, they want to insist and they want to come in by hook or crook and force and insult and assault our people. We are not yet out of the wood, and we want to plead to our communities that you've been dry for almost 5 months. Our advice to you is, if you can remain dry, that is the best way to do. If you have to drink, if you can drink for just to keep yourself happy, but not to go to the extremes, because that's where you lose your concentration and your responsibility.
So, Dr. Lekhoathi, what would Denosa suggest be done in terms of, the alcohol not being sold when you're looking at, the economy, specifically people who, for instance, rely on selling alcohol or on their jobs? For instance, if I work at a bottle store and now I'm out of a job.
It will be definitely naive on the part of Denosa to say without compromise and say alcohol must be banned in toto, because we are mindful of the fact that people who rely on their living and their sustenance on the proceeds of alcohol. It will be irresponsible, because the next thing, it will lead to hunger. And if it leads to hunger, it then becomes now again our problem as health workers, because you need to have food in order to take your medication. So we are between a rock and a hard place. But the fact that our people have been dry for so long, and they have a tendency, when they come back, they will want to behave as if we have accomplished the mission. We are far from accomplishing the mission. COVID is alive and it's kicking. All what we're pleading to our people is, because you might have a problem with your judgment, you rather stay out of it till such time we have really, really overcome the pandemic of COVID-19.
Dr. Cassim Lekhoathi from Denosa, thank you very much for your time.